Today we're talking UTIs, which
Yes.
I didn't think, because, I hear it all the time with
Yeah.
people, humans.
Yeah.
It can be pretty severe for pets if it's not treated, right?
Yes, it can be. So if we take it from like a big broad sense terminology, we may, we're looking at any infection in any part of the urinary system. So kidneys, prostate, bladder, things like that. But I think if we want to simplify it and kind of reference what most people think, it would be a bacterial infection in the bladder. I think
Okay.
is what most people would think of. And we can have everything from very subtle, kind of subclinical, not a lot of problems, to very severe, very advanced, very complicated cases. And one thing that's kind of different about the urinary system, as far as like bacterial infections in their bladder, there's often a whole lot of behavior changes that we see with that you don't see with other body systems. So a lot of the presentation is behavior, not just physical symptoms.
So it's
Yeah.
behavioral.
Yeah.
What are some of the signs? Because I know, does it impact cats and dogs differently?
Yes.
Okay.
Yes. So, let's see. So, as far as symptoms, things you're wondering.
Yes.
So, dogs and cats are going to have kind of different symptoms between the two. With dogs, our dogs are kind of in and out. Some dogs may have a doggy door.
Right.
So, you may notice that I have to go out a lot more. I'm asking to go out a lot more, a lot more than normal. They may be getting you up at night. It's like, I have to go out at 2 in the morning, which is fun. They may, have accidents inside. And so we may notice that. If we take them out and we're watching, you may notice that instead of going out and going, squatting and peeing, they're going in and out and in and out, or squat and move and squat and move and squat and move and squat and move. So it's an increase in frequency. They may seem like they're straining. They may seem a bit uncomfortable.
Okay.
If we have dogs that spend a lot of time outdoors, you might not notice that because you're not letting them out. You're not watching them. So those dogs may actually start to act sick and lethargic and really not feel good because the infection has been there a whole lot longer because we're not noticing maybe some of the early things.
Right.
With our cats, again, if it's, a cat that goes in and out, you might not notice it until they start to get really sick. If it's just an indoor cat, you may notice some litter box changes. You may notice them going to the box, in and out, in and out, in and out. You may notice them spending more time in the box. You may notice them cleaning themselves a whole lot more.
Okay.
They may get in the box. I've had owners say that my cat gets in there and just meows and doesn't seem like it's doing anything.
Oh.
It's digging a lot and turning around and squatting again, a lot more cleaning, just a lot more irritation. But I think one of the biggest things we see with cats, and this is where some of the behavior stuff might come into play, is we'll have cats that start peeing outside of the box. Cats take illnesses very personally sometimes. So they go into they go into the litter box and they squat and they go to pee and it hurts. And so they're like, oh, litter box, it hurt me. So
Yeah.
I'm going to pee out here. Oh, that hurt me. So I'm going to pee on the rug. That hurt me. And so they will start acting out and peeing in all these strange places. So we think it's a behavior, but it has to do with discomfort. And the cats are just trying to pee in a different spot to alleviate that.
I've never thought of it that
behavior
way.
is a big thing
wow.
with cats. Yeah. So it's those subtle little things that may alert us to them.
Now, have you seen this more in younger, like kittens and puppies,
Yeah.
versus the older animals? How does age play a role?
How does it distribute?
Yeah.
So in general, we see it much more in dogs than cats.
Okay.
We see it much more in females than males.
Okay.
Young puppies possibly, because they don't have as much control on the muscles in their urethra, so they may get bacteria into their bladder easier. Senior dogs are definitely going to have some more problems, or senior cats as well. There's a lot of factors that affect, their environment, their overall health, the health of their bladder itself can be a factor in it. And so senior pets with arthritis, pets that have underlying health issues, diabetics are drastically more prone to urinary tract infections, cats with kidney disease, dogs with other medical issues. So there's a lot of that plays a role.
Okay.
And we also have issues sometimes with grooming, because if we have pets that have a lot of hair kind of covering like on our girl dogs, we have a lot of hair covering their vaginal area.
Right.
That can trap bacteria, that can trap dirt. And so sometimes grooming issues in certain dogs can be a problem. If we have cats that have a lot of extra weight and a lot of extra skin folds, then we'll have owners bring them in, and we call them sanitary shaves, and we'll kind of shave some of the hair under their tail.
Okay.
Because again, that traps maybe a lot of moisture and urine and bacteria, and that can allow the infections to kind of develop. So there's some grooming things that come into play as well.
I don't know
Yeah.
if this is just something that like I heard once and believed it ever
Yeah.
since. When a cat gets a UTI,
Yeah.
is it something they have for life, or is that more of a bladder infection, or?
It's different. So
Okay.
the actual incidence in younger cats of urinary tract, of bladder infections is really low.
Okay.
It really is. As they get older, they have a slightly higher incidence of urinary tract infections. There's a very different condition in cats, and I'll give the big name. It's called interstitial cystitis, which is
Okay.
basically inflammation in the bladder wall, in the cells in the bladder wall. And that's more of the chronic issue. It has a whole dynamic related to diet and stress and water intake. So they can have underlying low amounts of inflammation. They can have the cystitis, which makes them more prone to infections.
Okay.
But I would say more often than not, we are dealing with something that's not so much an infection, but is a chronic condition in cats. So it's definitely worth getting all of those weird behavior, urinary things checked out, because it may not be infection, but there may be other things that need addressed.
So let's say this is something that goes unaddressed.
Yeah.
I know you brought it up for the dogs outside.
Yeah.
But what happens down the line when we do not go to the vet and have this addressed?
Yeah. So when you get to your vet, if you're noticing some subtle things when you go to your vet, probably the big thing is making sure we get a urine sample checked, because those behaviors can be attributed to a lot of other problems. So we want to make sure we actually get urine and get it checked.
Okay.
Not generally advisable to just throw it out, antibiotics and cross your fingers, because there may be other things involved. So, get the urine sample, find out what's going on. Is it a subtle infection? Is there a lot of inflammation? Pain meds are going to be a big part of what your vet should do as far as treating it, because it hurts, it's uncomfortable, there is active inflammation, so you do want to quiet that down. So pain meds, and then based on what we see on the urine sample, we can kind of direct antibiotics. Maybe certain antibiotics might be more fitting for certain types of bacteria that we might see. There may be a lot of white blood cells, there may be a lot of red blood cells. There may be instances where that will change the course of treatment. And then looking at, one other option would be sending the urine for a culture, meaning we send off the urine, we have the laboratory diagnose exactly what the bacteria is, and they can take it one step farther where they actually tell us exactly what antibiotics are best used to treat it, so we can really fine tune it. So getting your pet to the vet with those subtle little signs, getting the urine sample, properly setting up antibiotics, possibly a recheck to make sure it's cleared, and then pain meds are a big thing as well.
Okay.
So I think I went off track a little bit. I think you asked about complications. So if an infection is not treated, one thing that can happen in that regard is the infection can travel upstream, so to speak. So it can become a kidney infection, which is a whole nother level of illness that we have to deal with. Chronic bacterial infections in the bladder can cause permanent damage and scarring to the bladder wall. And probably one of the most complicated issues that we'd see is whether it's the formation of certain crystals or blood cells or bacteria or mucus or everything wrapped into one can actually cause a block on the ureter, meaning you've got an expanding water balloon that can't empty, to the point where it potentially could rupture. So an infection can cause severe enough problems that it literally can become life-threatening.
Is kidney stones possible? Because that's where my brain went to when you were describing
Kidney
that.
stones, bladder stones, more so. I've seen occasional kidney stones that are not as common, but those crystals can clump into a bladder stone. So absolutely.
Okay, so it
Absolutely.
could eventually. Oh, wow.
Yes. Yes.
Okay, so that's a lot to take
So
in.
it's a little more than just, a few and most of them are simple. Most of them aren't that complicated, but
Right.
we do have that percentage that are. So it's something to I guess, take seriously.
Absolutely.
Yeah,
Just like
yeah.
you would for your own
Yeah,
situation
yeah.
if you were to have one.
Yeah.
Now, when it comes to avoiding this or just
Yes.
trying to avoid it as much as you
Yes.
can, I know it's tougher with, what dogs may come in contact with
Yeah,
outside,
yeah.
but pet wipes, is
Yeah.
that something to bring up, or is cleaning, making sure the litter box is
Yeah.
well maintained? What all ways can we help?
Help the pets. So
Yes.
if we have just an indoor cat, I guess my advice there would be making sure the litter box is as clean as possible, watching the litter box. If you go from a big puddle of pee to little puddles, that might be something to look into.
Okay.
But yeah, keeping the litter box as clean as you can definitely help cats. If you have multiple cats, multiple boxes, things like that. Always access to fresh water for our cats. Some cats don't drink well, so the more they drink, the more healthy that is for their bladder, so that can help with our cats.
Okay.
Sanitary shaves, like we talked about, keeping up with grooming, things like that. And then underlying health conditions for cats is a big one too. If we have cats that are prone to that bladder inflammation, there are supplements, there are meds, there are diets that are fabulous at helping cats kind of protect their bladder health. So there's a lot of things we can do from a cat standpoint. With dogs, if we have mostly indoor dogs, again, plenty of access to fresh water, taking care of underlying health conditions. I don't think I would really worry about the wipes. Sometimes that can cause more problem than it's worth. If you do need to clean off your dog, just a warm, damp cloth, some of the like baby wipes or things like that may draw the dog's attention, and it may lick and lick and lick and try to clean itself, and that can actually introduce bacteria. So that could be so I would probably not do wipes unless it's maybe a medicated wipe or something directed by your vet, but just a damp cloth if you need to, but most of the time they kind of take care of themselves. If we have outdoor dogs, making sure that they have somewhere that is clean and dry or elevated or something like that. The majority, I would say 98% of urinary tract infections actually come from the outside. Meaning there's bacteria outside, dog sits down, you've got bacteria on the outside, they travel up the urethra into the bladder as opposed to coming from like the blood or the kidneys or working their way downstream, so to speak. So clean environment outside, having a clean, dry spot is going to be a big thing for some of our dogs that are outside a bit more.
What are your thoughts on the kitted litter that changes color to indicate any kind of health risks?
It can.
Okay. Because I'm just curious.
Yeah, I've seen it out there. So we do have cats that are diabetics.
Yes.
And so it will change with a certain amount of glucose. So, I mean, that might, if they see that consistently, that might alert them. It's like, hey, we should get to the vet and make sure we're regulated okay. If we have a cat that was prone to a certain type of crystal or bladder stone or something like that, and we're trying to keep the pH a little bit lower, using that litter will change a little bit with the pH.
Okay.
And so if you're consistently seeing a very high pH, that would let you know that we maybe need to address diet or hydration or things like that. So there can be uses for that. I wouldn't ever use it to diagnose or treat anything per se, but it could potentially be part of like monitoring some conditions.
I think that's important because in my head I'm thinking, oh, that looks like a fun thing to have at the house to change it up. It's
pretty litter.
Yes, pretty litter, literally.
That's what it's called.
And is it? You often ask yourself, is it worth the money? Do I truly even need it? But if you're right, if you have an animal who is prone to these types of illnesses and it's another tool to your advantage to monitor your pet, then why not?
And I think the fact that cats are so secretive and subtle that it may be something that gives you a little bit of a heads up as to, next time you go into your vet, it's like, I've noticed this color. Our middle-aged to senior cats, it's like, let's add a urine test to their routine.
Yeah.
Wellness exam, because that may pick up things long before it becomes an outward issue that they're going to tell you about.
Okay.
Yeah.
I feel like we went through a lot of topics or just a lot of information.
Yeah.
It's so helpful.
Yeah.
Is there anything else that you think we need to know just to, peace of mind or anything like that to help us with our pets?
I would just kind of general points, making sure there's, plenty of water, plenty of time to go potty breaks. I try to let owners know if you're going to be gone for an extended period of time, like during a day, maybe a neighbor can let the dog out just so they're not having to hold it an excessive amount of time. Watch for those subtle little behavior changes. If your dog usually goes out twice a day and now it's going out 4 or 5 times a day, I would look into that.
Yes.
And then any meds that your vet sends you, antibiotics, definitely finish them out. Sometimes they may feel better after a couple days, but finish them out because we can run into issues with resistance. So you want to, do all the meds that you were sent home with.
You got it.
So
we appreciate it. Dr. Tammy Wilson joining us from the Flint Veterinary Clinic, giving us all the details you need to know about UTIs. Remember, she joins us, or any of our vets here in East Texas, every Thursday, 12:30, making sure that your pets are thought about when it's, covering your health here on East Texas Now. Thank you so much.
Thank you.
We'll see you next time, Miss
Sounds
Tammy.
good. Bye-bye.